Hi friends, myself Dr. Vipulgurjar. I am the professor head of SVKS Medical College, Vadodara. Today I am going to discuss about the causes, basic causes of recurrence. This topic is mainly for the complicated fistulectomy or the fistulotomy. I am not giving that much discussion about the topic, the methodology, different type of methodology for the fistula. What are the causes of the recurrence of the fistula? This most common cause is one of the technique, but according to me, 30 to 40 percentage are the post-operative care is making them recurrence. This post-operative care is due to first the patient's fear of dressing. The patients are not coming regular basis, and this non follow up the cause the early breaching of the wound. Second thing, the surgeon's factor. Many surgeons are after the surgery, they are not taking care of wound by himself, and the staff are handling this type of cases. This also cause for the early breaching, and there won't be a granulation from the floor. And third, the dressing during the position, that means the patients are normally coming for the dressing, then we are doing the dressing in the left lateral positions, and because of this left lateral position we are not able to see the wound inside the anal canal, and we are just doing the good dressing from the distal part of the anal bulge, and might well because of this positioning, the lithotomy is the only answer. We have to do frequent, not every time but frequent lithotomy position fistula dressing, so we are able to see adequately inside the anal canal, and we can do proper cleaning. Mostly this complex fistulectomy or fistulotomy, they required approximately 3 to 6 or 8 week dressing. So after 20 days there will be a granulation tissue is already developed, and because of this hypergranulation there is some collection of discharge always will be there. So I preferred the scraping or forceful water jet or air jet dressing to prevent the hypergranulation tissue, as well as I prefer in a perineal abscess or this complex anal fistula surgery, relook under anesthesia is will decrease the recurrence rate, because once after the 20 days or 15 days if you go back under anesthesia, you will definitely find that there will be some surgical intervention is required in means of dressing, scraping, which is not possible with awake condition of the patient. Okay, uh, these are the cause. Now how can we can prevent? By simple old method is the marsupialisation. Many peoples are doing a primary closure of the wound to give benefit the scar, to give the benefit of a pain and early healing. But in our practice, we are watching that the primary closure after 15 days, these all sutures are give away, or or we have to remove. because of the partial dehiscence, and that will gives more contamination or stool impregration in the wound. So the marsupialization is so much beautiful method in which the margin of the skin is sutured, and because of this multiple suturing of during the marsupialization, it is not allowed a early closure of wound. Second thing, it also decrease the wound size. Third thing, because the skin margins are more sensitive, and they are because of this marsupialization, they are buried inside inwards, and it prevents the exposure of nerve ending. And because of this unexposed nerve ending, the post operative pain is decreased in compared to open non marsupialization wound. Believe me, after 3 to 4 days of this marsupialization, wound looks like a socialization of wound. What is the basic principle of wound? Non-healing wound? We convert non-healing wound in the socialization of wound that is a healing wound. And this way, the marsupialization definitely will help. So, in the pelvic or any perianal abscess or any complex anal fistula, rather doing a primary closure, marsupialization with the multiple suture has a decrease a lot in recurrence of the fistula. Please try do that, and believe me, this is a wonder, the post-operative care in a fistula, complex fistula surgery or infected wound. These are the neglected topic or the neglected the principle in a anorectal fistula surgery. And we are getting whatever the technique we are using, like a laser and a fistulectomy, whatever technique, lift and everything, but still we are getting a recurrence. Fistulectomy is a promising methodology, but the problem is the wound. But with this marsupialization, we are getting very good results. So multiple marsupialization is the maybe the answer for decreasing the recurrence of the fistula. Thank you very much.